Hello, my name is David Hogg and I work in computer science at the university. This short video is about artificial intelligence in medicine. So artificial intelligence, or AI for short, is about building machines that behave as if they're intelligent. It might be solving a puzzle, understanding what someone's saying, or describing a picture. And many people believe that there's enormous potential for the use of AI to spot when something is wrong with our bodies, to help doctors in finding out what the problem is, and then to let them know how it can be put right. And Leeds is a centre for research in this area, in AI and health. We work very closely with the local hospitals, very large teaching hospitals. We have many NHS organisations and medical companies based in Leeds. And we also have a vast data set of image data, for example, but also genetic data, medical record data, data of many different kinds associated with human health. Part of our research activity is a training program for new researchers, to train new researchers up to become leading researchers in AI and healthcare. And we have a number of students joining us each year. And those students will eventually produce research which will be published and hopefully would be transformational in the medical service. We're going to hear now from just 3 of our students who have been working over the summer on their first pieces of research, and they're going to show us what they've achieved after just 4 months of work. So first of all, it's over to Sam.
Hi, so I was looking at lymphoma and helping doctors understand this disease, in particular by classifying different subtypes of lymphoma, which is a time-consuming task, so this should help save a lot of time as well. So I created the tool, an AI model to do so, and I made it so it would work to help to accurately match the expert scores for each tissue sample given to the doctors. And then once I get a score for that tissue sample to help classify how severe the disease is, I would then make a heat map to show where the model is looking to help build trust. And in the future, I want to pair this with genetic data, so that would help the classifier achieve even more accurate scores and really help understand lymphoma a lot more.
Okay, thanks, Sam. And over to you, Jason.
Hi, I'm Jason. My project involves researching the best way to reduce the size of histopathology slides, which are microscopic tissue slides. The histopathology slide here is around 707 times bigger than an iPhone image. This project involved using AI approaches to reduce the slides into latent image features, while seeing if artificial intelligence classification on image features was possible. The results showed that the slide images could be reduced to 10% of their size, with the possibility of using latent features in diagnosis classification, possibly reducing NHS costs, allowing for reallocation of NHS funding.
And finally, we're going to have a quick look at Tom's research. What Tom is doing is closely related to what Sam's doing. He's looking at images that contain abnormalities of cancer abnormalities, and he's trying to explain how the system actually generates either a normal or a cancer diagnosis. So what he does is he uses a new technique which progressively blurs different parts of the image, seeing if the confidence in the outcome from the system is actually changed as a result of the blurring. And eventually ends up with something like this, that in which only a part of the image is unblurred, and that part of the image still gives a confident diagnosis, and so it must be that that diagnosis is actually coming from this part of the image, and so he's able to identify that this is actually the cancerous tissue. So this is all about producing explanations for doctors of the conclusions that the AI is coming to. Tanya.
We hope that these projects showed you the potential of artificial intelligence research. we are starting with problems from practice, from what the doctors are telling, the clinicians are tackling. How can we take those new technologies to the practice? How can you join us in the future? Well, these are the possible disciplines you can study at school, at GCSE, at A-levels, then later on at university. So our students are coming from very diverse background, are then being trained into the latest developments of the artificial intelligence, and they are at the forefront of innovating healthcare and helping save lives. So join AI research in the future and be one of the future generations of researchers in the United Kingdom.